ask a question during the Q&A portion of each session, please use the raise hand function to indicate to our moderator and our panel that you would like to speak. And when called upon, please do feel free to unmute yourself and turn on your camera as you are able. If you should have any technical issues throughout the call, please feel free to drop a note in the chat. Our UNF events, Claire, is happy to assist. She's a lovely colleague who's already dropped in some PSAs, as you'll see for your reference there. And so with that, I'm going to turn it over to Lori Sloat. She is our Senior Director for Global Health at the UN Foundation and lead on immunization. And she will take it from here. So Lori, over to you.
Thanks, Megan, and welcome everyone. Good morning, good afternoon, and good evening. Really appreciate the opportunity to moderate this really interesting session. So just a little bit of a scene setter, and what we were intending to do is to provide a forum where we could sort of informally discuss some of the hottest topics in immunization today ahead of the World Immunization Week, which is next week. So over the next few hours, there'll be 3 sessions, as you're all aware. And the first is on vaccine confidence and vaccine acceptance. And then we'll, after that session, it'll be followed by the information on the COVAX facility, as well as the issue of equitable access. And then finally, the last session that we'll have is around the Immunization Agenda 2030, and also about routine immunization and the impact that COVID has had on other vaccine preventable diseases. So with that, I would just like to introduce this first session then and welcome our esteemed panelists, and very happy to have you with us. So there's been a lot of discussion around what's happening in the terms of vaccine confidence and vaccine acceptance. And today we thought we'd delve into some individuals who are working in various communities and the impact and challenges this has had as we roll out the COVID vaccine. So just briefly, I would like to introduce our panelists and welcome very much Dr. Christina Toledo-Cornell. She joins us from the Lumi Nation, where she's been working for 2 years, and she's been working in the COVID response in that realm. And then we were also joined by Malcolm Glenn. Hello, Malcolm. Nice to see you again. And he's the Director and Public Affairs Advisor for Better.com, and also, I want to get this right, Health Action Alliance, working with the business community in terms of how it also can help in terms of the COVID vaccine response. And finally, I'm joined by Sabisu Latuako, and he is the Advocacy and Partners Manager for PATH in South Africa, working in many countries in Southern Africa, not just South Africa. So we look forward to hearing perspectives from that angle as well. So without further ado, I would just like to invite the panelists to please keep your remarks to about 5 minutes, because we really want to make sure that there's time for discussion. And like I said, informal dialogue, it is on the record, but the more informal dialogue we can have, I think we'll really be able to get to some of the challenges you're facing, all of us are facing. So Dr. Toledo-Cornell, over to you for a few remarks. Thank you.
My name is Christina Toledo-Cornell. I am a public health director, as you mentioned, here at the Lummi Tribal Health Center in Washington State. I've been working with the tribe for the past almost 3 years now. And it's been a very interesting journey with vaccines. We start working on it very early on because we had a few issues before with hepatitis A and hepatitis B. So there was already like a big discussion ongoing within the community about the need for vaccination for particular conditions. So we had done a lot of groundwork already, but there was a lot of hesitancy among the individuals who were affected by those 2 conditions, mainly younger people, people who may have less stable life situations in general. Once we got the COVID-19 vaccine last December, there was a big rush, and there was just very little vaccines at that point. So once we get more vaccines, the people who really wanted to get vaccinated, particularly the elder generation, really were vaccinated very quickly. So we're up to probably around 90% of those individuals are now vaccinated. But as we go down to the younger groups of people, it's a lot more difficult. And that, I think, is a variety of reasons. One, perceived barriers, true barriers, and the other one, just in general concerns about vaccinations, as we had experience with trying to get people vaccinated for hepatitis A and hepatitis B. So we had deployed a variety of different things, but particularly trying to encourage people, educate people, and sort of understand where people are coming from, what troubles they have. It certainly is a little disconcerting still that we had probably vaccines, sufficient vaccine now to vaccinate 3 or 4 times over the entire population of the tribe, but we had only probably vaccinated about 40 to 50% of all of the individuals who currently are eligible for vaccinations. So that certainly is a lot of work to do, and I'm interested to join the other panelists to see what other interesting things they are doing. I can tell you a lot more of what we're doing, like outreach, salmon dinners, very cultural things involving cultural leaders to develop plans and um, um, ideas that are acceptable to people and maybe interesting and attract people to get the vaccines, and dismantle a lot of the misinformation that they have been affected by your usual internet sources.
Great. Thank you so much, Dr. Toledo Cornell. I'll hand it over to Malcolm.
Thank you so much, and thank you everyone for being here this morning. As Lori mentioned, my name is Malcolm Glenn, and I'm an advisor to the Health Action Alliance, and you can learn more about our organization at healthaction.org. And I've spent most of my career leading equity efforts at various companies. I spent some time at Google and Uber, and more recently I've done so in the startup community where, as mentioned, I'm the director of public affairs at better.com. But I'm here today in my capacity with the Health Action Alliance, and we're working to really just accelerate the business community's response to COVID. And we officially launched in February, so our focus thus far has almost exclusively been on vaccines and vaccine adoption. And very practically, we create materials, we host events, and we really try to provide a playbook to help businesses of all sizes communicate with their employees and their customers about the importance of vaccines and work to increase vaccine adoption. And I think folks on this call probably know, but this is really important because there's data that shows that, particularly in the United States, people actually trust information from their employer more than they do from other sources, including their elected representatives. And there was a recent poll from the Kaiser Family Foundation that showed that employers can actually make a real difference within groups that are either undecided about whether they're going to take the vaccines or more hesitant. One bit of that poll said that 37% of employees who are still unsure about vaccines say they would be more likely to get vaccinated if their employer offered, say, on-site vaccination clinics. And so depending on the nature of the business, leaders in the private sector have a huge role to potentially play. And our materials and our programming are designed to help businesses really do that, play a big role. And we have both general resources to make sure that businesses of all shapes and sizes are communicating with their employees. And then we have specific resources tailored to small business owners, folks who might be a little bit more resource constrained, and then specific resources for members of employee resource groups or diversity, equity, and inclusion leaders that speaks specifically to the concerns of those communities who have been disproportionately affected by COVID. And in fact, I actually co-host a bi-weekly workshop on Wednesdays at 3 p.m. Eastern to help ERG and DEI leaders promote vaccine education and adoption within their communities. And just briefly, I'd say there are 3 really important things that we've been encouraging businesses to do to boost vaccine confidence. The first is just to make a plan, and it sounds basic, but putting on paper what you plan to do in terms of helping your employees get vaccinated is really, really important, particularly now that vaccine eligibility is open to all adults in the United States. Increasing and facilitating that access, which I know we're going to talk a little bit more about later, is really important. And so as I mentioned, on-site vaccination clinics, bringing in doctors. We're actually hosting a town hall on May 4th that's going to give more guidance as to how you can create that plan, considering where we are in the pandemic. Second, I mentioned, folks have mentioned incentives. It's important to be thoughtful around how incentives are structured. There's been some research that actually says If the incentive is too high, the monetary incentive is too much, it will actually increase worry from employees. So making sure those incentives are modest if you're an employer who can provide incentives, and particularly tied to access. So maybe not just a small amount of money, but an ability to reimburse employees for their transportation to and from vaccine appointments, or paid time off for someone when they're getting a shot. And as you may have seen, the Biden administration announced yesterday a plan to actually help give tax breaks to certain companies that are providing those incentives, particularly in the way of paid time off. And finally, third is sharing stories. What we found is sometimes sharing stories is actually more valuable than sharing facts. And I myself was actually a participant in the clinical trial for the Moderna vaccine here in the United States. And in a number of my circles, I've shared that story of why I got involved and what it was like. And it's been really valuable in showing people that the vaccines aren't just safe now, but they were actually tested in a safe manner as well. And so I'll just lastly say, there's one company that we've recently been talking to that I think has done a really good job of being proactive in both vaccine awareness and facilitating access. We were joined at a recent ERG and DEI workshop by a representative from Utz Quality Foods, and they make popular snack foods like chips and pretzels. And they worked with their state health department in their home state of Pennsylvania to get doctors to conduct on-site vaccine clinics for people in their manufacturing facilities. And that was really, really important because lots of folks were worried about what it was going to mean for them if they left work. And they also offered vaccine signups through their company's internal social channel. And they also went in person to their company's warehouses to hand out our Health Action Alliance materials, CDC materials, all in both English and Spanish in order to answer questions from people who were hesitant. And during the course of their in-person engagement, they actually got people who said at the start that they weren't going to get vaccinated to actually sign up to get vaccinated. So it was really rewarding to see that a lot of this work is practically making a difference on the ground. And so I think this is just a really great example of how far businesses can go if they're really working to keep their employees safe. And we're really excited to continue working with other businesses to get them to the same place as some of these other companies are. So really excited about the conversation today and look forward to the questions.
Great, thanks so much, Malcolm. Those are great examples, and I also am looking forward to hear some of the questions that some of the colleagues on the line will ask. Sibuso, over to you, please.
All right, thank you so much. First of all, thank you for the opportunity to be part of this discussion. My name is Sibusiso Hlajago. I'm the Advocacy and Partnerships Manager for PATH, based in South Africa. PATH is a global and international NGO that works in several countries. Actually, we work in more than 70 countries on different programs, including immunizations, and we are also involved in the COVID-19 response. I'm also part of what's called the COVID-19 Africa Vaccine Delivery Alliance, AFDA, which is led by Africa CDC. So just for the context of this discussion, there's quite low middle income countries, including South Africa, have seen quite a increased hesitancy on vaccines. And there have been several factors that have contributed to that. South Africa in particular has had an experience with the AstraZeneca vaccine in particular, which came in country and then subsequently couldn't be administered due to the efficacy against some of the strains or variants in South Africa. So that in itself did contribute to vaccine hesitancy. But I think the point is vaccines do work, and that's what we do at PATH. We emphasize that we know that vaccines work and they're the most cost-effective and life-saving tools to prevent diseases. And they will be the most, it's what will take us out or pull us out of this pandemic. And then whilst it's true that vaccines might have different success rates against different variants, the fact still remains that vaccines do work, and we still do encourage people to take vaccines. And whilst some vaccines might show little protection against mild to moderate infection, in theory, it will still offer a significant protection against serious infection. Now, just going back to vaccines hesitance itself, there are several factors that continue to contribute to hesitancy in South Africa and other low and middle income countries. I think first of all, there's been a lot of misinformation, which is also fueled by science skepticism and also lack of awareness on vaccines. And as such, there is a strong need for public health practitioners to continue to give out information that is factual, information that is truthful about vaccines, to also allay the fears and the worries that people have. The side effects, blood clotting, I think are some of those issues that have contributed to vaccines. And I think we need to be more vigilant in giving out information about the level of adverse events with regards to vaccines. Also, countries need to be more vigilant in terms of setting up information sharing centers, and also centers where people can get more information and report adverse events or some of the side effects that might come with vaccines. I think the other thing that I'll just note is some of the actions by leading countries in terms of stopping certain vaccines and starting vaccines. They did not do African countries, particularly those that are reliant on vaccines such as the AstraZeneca. They did not do the efforts to counter vaccines hesitance any favor. Actually, they moved our efforts backwards, because when a first world country says this vaccine is not good enough, and in some countries that's the only vaccine that's available, then people tend to be very hesitant to take those vaccines. And I think some level of the way information is shared and the way decisions are made, I think needs to be relooked from a country perspective, but mostly also from a global perspective. Also, I think in terms of just Africa itself, the role of WHO and national regulatory authorities needs to be amplified. People need to understand more that they exist to ensure that products that reach the public are products that have been tested, are products that are safe, are products that have shown a certain level of efficacy. So without people understanding this, our population still feel exposed and also uncertain of products that are coming through as well. And then other factors that we've seen from just this part of the world contributing to vaccine hesitancy, it's the uncertainty surrounding the availability of vaccines. I mean, and this is mostly a problem of or a challenge for low and middle income countries. So people need to be sure, for example, that if they're receiving a vaccine that's got 2 doses, they will be able to receive the first dose and they'll be able to access the second dose without necessarily being worried to say, if I get this dose at this time, won't there be issues where the vaccines are coming from, and I might not necessarily access the second dose. That also is coupled with just public health or health systems challenges that developing countries continue to have. So it's the issue of the dose being available, but also it's the issue surrounding the logistics around the procurement. It's the issue surrounding getting the vaccines to the end point, to where the people are supposed to receive the vaccines. I mean, it's nice listening to Malcolm and him explaining what they are doing in terms of factories and what the healthcare system and the private sector is doing to ensure that people receive vaccines. Unfortunately, most countries, particularly in Africa, that's not the case. Our healthcare systems are not strengthened that much to be able to ensure that we have that level of efficiency. I mean, looking at it, this is the first time that most countries will be having vaccines that are administered to everyone in the population. We're struggling with other countries struggling with basic immunization programs, and now if you've got a project or a program that's supposed to vaccinate everyone, the healthcare systems are overstretched, and then sometimes it's issues around cold chain management, sometimes it's issues around human resources for health. Are we going to have the right people administering the vaccines? Are we going to have enough of our healthcare workers ensuring that everybody get vaccinated? And when people see that the sites where the vaccinations are being administered are not up to standard, they do lose a certain level of confidence on the vaccination programs. And it's because either they think that the vaccines themselves might not be potent by the time they're given, And then we need to have more focus in terms of health education, make people understand that vaccines do work and how they work and how they're regulated and how safe they are, and why we're able to get to vaccines much quicker for COVID-19 than we have, and then we still continue to look for vaccines for TB and other diseases such as HIV as well. And then we also need to make sure that then the governments, they're capacitated enough to handle this rollout of vaccines, to ensure that people are confident in terms of the vaccine itself. We also need to look at health information systems. If it's a vaccine that's got 2 doses, how are governments going to track if the person who has received the first dose receives the second dose, who has been vaccinated and who has not? If it's a 1-dose vaccine like the J&J, we need to be able to tell who is getting the vaccine, who is still due for vaccines, and we need to have working systems in terms of bookings and ensuring that people are accessing vaccines. I think I'll end here just to be on time. Thank you.
Great. Thanks so much, Sibusi. I mean, just listening to the 3 of you, I mean, this actually highlights how complex this issue is, from what the challenges are, but just really interesting to hear some of the interventions that you have are very specific to the different communities. And as Sibusi mentioned, some things that are working in some communities in other countries is not applicable elsewhere. So this is why it's so good to hear from different perspectives. And I was taken by Christina, your example of having salmon dinners with the community as a way to sort of, create trust really in terms of the issues and so on. So, the challenges are sort of in some ways the same, in a broad perspective, but they're very localized and contextual based on the communities of where we need to get the information. So really just happy to hear the diverse range of experiences you've all had on this issue. And now I'd like to go ahead and open it up to some questions that people may have. And if you do have questions, would appreciate if you could just use the raise the hand function. I don't see any unless I'm not seeing.
I think Jenny had her hand up.
Okay, thanks. I can't see that. Great to be the moderator and not see the hands. Wonderful. Okay, Jenny, go ahead.
Hi, yes, wonderful discussions. I just want to ask, about right now there's a lot of concerns regarding the side effects, particularly with AstraZeneca and J&J. How would you actually tell people, explain to people, because how would you explain to people that would make them confident to still take those vaccines?
Okay, great. I mean, I think I will, that's a great question for all 3 of you, actually, because you may be dealing with this in your different variants. So who would like to, I'll start maybe with Christina. I don't know if you've had this issue in particular, but then I'll ask the others as well. Go ahead, Christina.
Thank you. We don't have the AZ vaccine here in the US yet. I actually was going to participate in their clinical trial, and then we decided not to in the last minute and switched to a different product. But the J&J was deployed in our community, and actually it was a vaccine that we had extremely high hopes for because it's 1 shot, particularly for this community that's very difficult to reach. So clearly, it's a little bit unfortunate that's still paused. When people ask me about that vaccine, I spend a lot of time talking to them that any medical intervention carries with it some risk. This one particularly, even though the reports of the risk may be serious, and we take that very very seriously, it is exceedingly rare. When we look out of here in the US, 7.6 million people have gotten that vaccine, and we had report of 6 or 7 people. It may be early, maybe have more people that come to light as clinicians now understand more about those side effects that have been reported, particularly blood clots in the brain, which clearly is a scary thing. I spend a lot of time talking to people, though, that the vast majority of people are going to be completely fine, and the vaccine is pretty safe. We look at other treatments that we give to people, even like blood pressure medication. That will be probably a bigger percent of those people who will react poorly to it. It's not unexpected that you have some severe side effects that weren't first come up in the studies, because when you look at it giving to 7 million people as compared to 30,000 people, there is a big difference of the opportunity for you to see side effects that you hadn't seen before. But I strongly encourage people to look at the process as it works. There's a lot of eyes making sure that the vaccine is safe. We're studying why is that causing in those particular young women and not other, not men or older people. So there's a lot of discussion about the risks and benefits and how we think overall the benefits much outweigh the risk. And I think that as doctors are aware of those potential side effects, we probably can treat them better and perhaps make sure that they're not going to be death for anyone. So a lot of discussion about risks and benefits and how medications work, and usually people were okay with that. But again, the vaccine rollout had just started with the J&J. We had distributed probably around 300 or so of them. And then it went in a pause, so it hasn't come back up. I think once the FDA allows it to go back in the market, we have a bunch in the freezer. So then there's a lot of discussion. There will be a lot of discussion and opportunity for people to ask questions and concerns to make sure that they feel confident that that vaccine works for them and that we are on top of any potential side effect that they may not be aware of it.
Great, thank you so much. Maybe over to Sibusiso for you, because in the South Africa context with AstraZeneca, what has been sort of the response there to this question?
All right. And thank you for the question. I think first of all, I'll start by mentioning that South Africa actually did cap the use of AstraZeneca as soon as we got information on, first for two reasons. It was mainly for its efficacy or low efficacy on the strain that was discovered in South Africa. So I think that was the main reason. But then nonetheless, the issues around blood clots, I think they're not just on the AstraZeneca, they're also reported on the J&J. I think the best way to go about this is, first of all, explaining the role that regulators play, ensuring that vaccines are safe, are effective, actually before they are rolled out. And also, I think the fact that we discover or adverse events, it's in itself, it shows some level of transparency in terms of information being shared on the vaccine itself. Some of the points that might be important in terms of messaging, particularly on the AstraZeneca vaccine, is the fact that we've had nearly 2 million people that have received the AstraZeneca vaccine. The reports of blood clots, they still remain very, very, very low. So I think that's quite important to say. Majority of the people quite a lot of the people that have received these vaccines, they have not had issues around blood clots. And then I think it's also important for countries that are administering any vaccine to have a very clear line in terms of how do people report should they experience clots. I'll make an example of South Africa. I think it was yesterday that the minister was in the media saying we have set up this site, we've set up this call center. If people are experiencing any form of adverse events related to vaccines, they should raise their issues with this office, and then there's a team of medical personnel that has been assigned to review whatever complaints or whatever adverse effects or events are being reported to those lines. Now, a lot of our African countries, I'll speak broadly for African countries, they might not necessarily be at the same level as South Africa. And then the bigger question is, should they not then administer the AstraZeneca? Most of the COVAX countries receiving vaccines from the COVAX facility are receiving the AstraZeneca. And I think it will not be very, I don't think we should say countries should not take the vaccine. I mean, still, it's better to have some level of protection, and also looking at the number of adverse events. I think there's still every rationale for countries to continue to administer the vaccines unless we get new results that show a significantly increased incidents in terms of the blood clotting or other adverse events. I think we still the continent is better off being protected against COVID-19 than leaving it up without any vaccines. I think the other thing that I'll still mention is the difference between first world countries and low middle income countries is we do not necessarily have a lot of choices in terms of what is available, as most countries are relying on facilities that are facilitating vaccines coming in country. Thank you.
Okay, I just said, well, I asked Malcolm to speak, and then I maybe have a follow-up if others don't. But Malcolm, over to you. Right? How does this, in terms of the J&J and the business community, has this come up in some of, you say that you have weekly workshops and so on, and so great to hear some specific examples of what people are saying, what to do, and any reactions from employees on this.
Yeah, so we are fortunate enough to have some founding partners who have been really helpful in guiding the way that we respond to some of these issues. So we work with the CDC Foundation and the De Beaumont Foundation and the Robert Wood Johnson Foundation. And so they've given us some guidance. And I think there are kind of two things. One is we have messaging around side effects more generally, and we reinforce that the traditional side effects, things like soreness at the arm site, headaches, fatigue, all of that is normal. All of that is indicative of the fact that the vaccine is working and your immune system is working. And so you should feel good about that. When it comes to the AstraZeneca and Johnson & Johnson vaccine, of course, in the United States, we just have the Johnson & Johnson vaccine. We did one of those workshops in the immediate aftermath of the announcement. And we had already gotten questions from folks asking less about themselves and more about how they talk to folks in their communities or in their workplaces around confusion around potential side effects. A lot of those initial questions were actually about misinformation. So things that were stated as side effects of the vaccines that weren't true. But when it comes to the Johnson & Johnson vaccine, I would echo a lot of what my colleague said. We did a lot of work to really reinforce the scale of how many vaccines had been distributed and the really small number of adverse side effects that we've seen. And so putting that in context, I think was a little bit helpful in terms of making people feel better. Again, as my colleagues have said, the fact that the pause took place is indication of the fact that the system is working and that there is transparency and that people should feel confident in how these processes work. And then the third thing that I think we're confident about is we're probably going to receive some guidance soon from the CDC around how the J&J vaccine can be reintegrated into the population, and perhaps there will be specific groups or communities that are deterred from taking it. But in general, it's still going to be something that's on the market, and we're going to continue to reinforce the scale. And as I said earlier, the stories of people who have taken the vaccines and had a positive experience are really valuable. So we've encouraged folks to find folks in their community who have gotten a J&J vaccine, and to reinforce that they haven't had issues, that issues are exceedingly rare, and that if the vaccine gets reintegrated into the population, that will only be because the pause determined that it was safe, particularly for the communities that the CDC is going to recommend take it.
Great. Okay. Great answer. So I'll turn it over to if others have questions, and then I have some follow-ups if there's time. So on that, because it's a very interesting conversation. But others who would like to ask questions, again, I don't see any hands, but I can't tell if it's just because my function's not working. Okay, so I'm going to just then take the prerogative of the moderator to ask a few more in-depth questions. So, I mean, I guess my real question here is like, is it working, right? Just from my point of view, being in the United States, friends, colleagues, people call you up in various communities and say, is it really safe? Should I take it? And we say yes. And then, but what's the outcome of that? I mean, do you really see that the messages that you've all just described, do you think that that is actually turning the tide and that people are going to take the vaccine despite some of these concerns? Or there's it's hard to get, a handle on the real nature of the vaccine hesitancy in this light, right? Or is it people listen to the messages and they still say, not good enough, I'm not going to take it, I'm going to wait for another vaccine, for example, or I'm not going to take one at all. So do you see any on kind of the outcome side of things of that this is working? I don't know if anybody can just jump in off of mute if you want to, one of the three panelists.
Great. I'm going to start. I do think it's working. When I looked at it, I think that what's going to happen is that the vast majority of people are going to get it in this first wave of vaccinations. We're probably going to miss 20 or 30% of people who are like, I am very scared of this, I'm not taking it right now. But I think another 10, 15% of those people, this is just my sort of understand and talking to people. Like they said, I want to wait 2 or 3 months to see how things are going. I just want to wait a little more time. So there's a chunk of people who are strongly considering, but they want to wait. And then there are some people that are probably never going to get the vaccine. What I'm hoping is that that last group of people is so small that by the time we have everybody else vaccinated, it's probably not going to make a huge difference. For example, with the measles, for example, there are like some parents in the US who will not vaccinate their kids no matter what, but they are in a community where most of the people are vaccinated, at least 90%. So then there is no transmission of disease in general, unless they live in an enclave that has a lot of those parents that live together. So that's how I see unfolding. I think that it's very reasonable for people to say, well, this thing has been around just for 6 months. Why am I going to jump in front of the line to get it when I am like otherwise healthy, young? The chance of me of dying of the virus is very small. So I think that with time, we're going to see more people accepting it as they see that their friends, colleagues are getting it and do things that they can't get it because of the risk of getting the virus. So that's how I see happening just by my conversation with patients. But I wonder how the other panelists feel about it.
Yeah, I'll just say that we paid a lot of attention to the polling in the United States that has given us indications over the last couple of months how much of the population continues to be hesitant. And we've been really pleased to see that those numbers have gone down. And so as more and more people have gotten vaccinated, the number of folks who still describe themselves as hesitant, or the even smaller proportion, though still sizable proportion, who say that they won't get the vaccine has decreased. And so that's positive. And so we feel like we're seeing some progress there. And we've also started to experiment with some different messaging. And so I really appreciate what Christina just said around the uncertainty amongst populations that are perhaps younger and feel like they're healthy and feel like they don't need to get the vaccine. We started really impressing upon folks that getting the vaccine, even if you feel like you don't need it, is less about you and is more about your community. And so we said, do this not for yourself, but do this for your grandmother, or do this for the grandfather who you don't even know, who wants to go and see his grandkids without having to worry about his safety. We've had some conversations as well with some of our partners, particularly in the business roundtable, and have seen the degree to which, at least anecdotally, some of these interventions, and particularly the communication around debunking the myths, sharing stories, and really leading with empathy, has improved vaccination rates within specific companies, so within these very small communities. What I think is also going to happen is, because the rollout, at least here in the United States, has gone faster than I think people anticipated at the beginning of the year, we're going to bump up against those people who are very, very hesitant more quickly. And so there is always going to be some portion of the population that is deeply hesitant or is unwilling to get it. And I actually think it might be a mark of success that we're starting to encounter those people sooner rather than later, because it means we're doing a better job of vaccinating the people who want it. So we're never going to get all of those people, but we're experimenting with different messaging, and we're looking at the numbers, and we are seeing positive signs with those numbers. And I think we just have to continue as we reach some of those more and more hesitant populations.
Okay, thanks. And actually, there is a hand raised, so I'm going to jump to the next question. So Jen Kirby, if you want to go ahead and ask your question.
Sure. Thank you so much for doing this. This question is probably more for Dr. Siviso, but I'm happy to hear anyone else's thoughts. But I'm curious about, you mentioned that the announcements about the J&J and the AstraZeneca have really set back some of the the efforts to get people vaccinated. And I wondered if you had a thought about what regulators in the US or the EU could do to sort of help ease some of this perception that these are vaccines that these countries don't want, but yet, those other countries are sort of going to get, if that makes sense.
Yeah, that's a great question. I think first of all, it's acknowledging that regulators have got a responsibility to ensure that populations receive vaccines that are safe, and that's regulators across the globe, across the spectrum. So I think the announcement itself, it had to be made. I think the what needs to be done is it's this thing of negative news travel faster and people cling onto it. So the second time around, the announcement is made that no, actually now we're going ahead with these vaccines, or I think it doesn't travel as fast, and by the time it comes, people are already hesitant. I think it's more of a combined efforts, global efforts in terms of reinforcing the positive messages around any or all of the vaccines. I think it's reinforcing messages to say the risks of contracting and dying from COVID-19, they far outweigh the risks of the side effects from receiving the COVID-19 vaccines. I think that's the message that needs to be it needs to go out there. I think it's also the recognition that in terms of the vaccines and what countries have in terms of access is necessarily not the same. And to say that, I mean, we don't want people saying, for example, country X might only be having access to the AstraZeneca vaccine, and they might not have another option to say, I'll take a J&J or any or other of the other vaccines. So we still need those programs, those vaccinations to continue unless countries say they are no longer going forward with those vaccines. So I think it's the responsibility of countries. Globally, it's the responsibilities of entities such as the African Union to continue engaging countries, telling them the advantages of taking those vaccines. I'll make an example of AstraZeneca again. It had an issue in terms of its efficacy with regards to a strain in one country, but that does not mean that it's not effective against other countries that might not have those strains. So it is having those conversations being emphasized so that people gain confidence. And I think then the other issue is the issue of leadership. When we've seen leaders going out, being in front of the queue and taking those vaccines and speaking positively about vaccines, then that also increases the level of confidence from the public in terms of confidence in vaccines, and also in terms of addressing vaccines hesitance. We've seen, I think we're increasingly seeing ministers of health, presidents, influencers coming out and taking vaccines, going social media to say I've been vaccinated. I think it might seem as small acts, but I think those acts are quite important in terms of addressing vaccine hesitancy. I'll still stress the importance in terms of speaking positive messages around the vaccines by our countries, and also if countries are deciding to put aside other vaccines, I think it's also imperative to then state to say this is the reason we're putting it out, we're not using it, but this is not to say that effectively it does not work at all. I think that becomes a more comprehensive message in terms of addressing what you've just mentioned. I hope I have responded to your question. Thank you.
Yes, thank you.
And briefly, I'm from Brazil, and my family lives down there. And the only vaccine that they have available now is this Sinovac, which is a Chinese vaccine. And initially, people were like, "There's just no way I'm gonna take a Chinese vaccine. Why don't we have the vaccines they have in the U.S., for example?" Um, and that was just before the rollout. Now that the rollout is going, people are getting it. The change is huge. Like everybody wants it. I think they're in that same situation where there's just a much smaller percent of people that now are saying that I'm not going to get this vaccine, just for the fact that it was initially said, well, this is a Chinese vaccine, whatever implications attached to it, which it's unfortunate. But I think that people realize that it's a great product. It's a product developed by scientists. Doesn't matter where those scientists are. In China and the US, doesn't matter where they are. They're scientists that have developed a great product that's working. And that's what we have available right now. So that's what we should take. But also looking at how the vaccine deployments happen, I think what's going to happen in the future, even the vaccines are stuck mostly on developing nations now. I think that as more become available, some of those vaccines will become available elsewhere as well. So what I'm hoping that throughout the world we'll have a variety of vaccines to choose from. For example, Novavax vaccine hopefully will come in the market as well. So as more vaccines in Brazil, they have this vaccine that's being locally developed. So I think that once choices become a lot more to pick from, I think that a lot of those problems are going to be less of an issue, where people don't have just one product to choose from. If they really feel uncomfortable with that product, they may have an alternative. I think that that's one of the things I hope that COVAX and other um, institutions working with this make sure that countries have access to some of those other products, so that we are not leaving people behind, and that we are not leaving countries that have the vast majority of their population unvaccinated. Because if you look at the situation in Brazil right now, it just doesn't help anybody, because if all of us here, the rest of the world, are partially protected, but we have this potentially for new variants to be emerging somewhere else, puts everybody at risk. So I think that as a world community working together to get as many people vaccinated everywhere, it behooves all of us, because again, this as COVID had taught us this past year, is that we're all interconnected, and these variants have no boundaries. They go between each countries. And it's important that everywhere has options, and that people are being protected no matter where they live. And I think that that's going to be less of a problem as we have more products coming to the market and more products available elsewhere.
So I think there's a related question to this that I believe Josephine wanted to ask. Josephine?
Thank you very much. Yeah, Christina just mentioned about the perception about Sinovac vaccine, and I'm curious how it is like in South Africa. How do the people perceive the Chinese vaccines? As I understand, Sinovac is providing 5 million doses to South Africa, and are people hesitant about it, and what's the perception like there? Sorry, I can't hear you.
You're on mute, Sibuso.
Right. All right. I hope you can hear me now. So I think at this point I might not necessarily respond directly, because the vaccine that has been, the vaccine, the program itself has been halted after the Johnson & Johnson complaints. So far the vaccine that, we've got almost 300,000 people that have been vaccinated, but almost all that has been the Johnson & Johnson vaccine. And I think we've been informed by the regulator that more vaccines have been approved and they're going to be rolled out. And at this point, I will not say what the reaction will be, especially for those vaccines that I'm not aware that they have already been rolled out. But I think there is an effort to educate the public, to say there are different vaccines that are going to be part of the program, and all these vaccines have gone through the stringent regulatory approval processes, and they're all vaccines that have been effective. One thing that's been good is there's been information in terms of the different vaccines and the level of efficacy that comes with each one of them. So I think if enough information is shared with the public, it should not be more of an issue to say it's a Chinese vaccine, or it's a vaccine from Russia, or it's a vaccine from India. I think the onus is on the government, the national regulator, to ensure that information is shared in terms of the efficacy of these vaccines, and then people can then be able to say which vaccines they're able to take. I think at this point we've just had the J&J vaccines that's been rolled out, and we're waiting for SAPRA, that's the National Regulatory Authority, and government to advise on which vaccines will be coming in next. Thanks.
Thank you. Could I ask a follow-up question for Christina? What are the reasons for the change of attitude towards some Sinovac vaccines? You just mentioned that people find it a good product, but how do they know? I mean, why is that such a big change with the attitude?
Well, I think because, well, and I'm very aware of the Brazil's situation, but I'm not physically there for the last 2 years. So there may be people out there who are much better off to tell you why it's that change. But just observing and talking with my family who all lives there on our WhatsApp group and reading the news, is that the country is going through a massive influx of cases. There are over 3,000 people dying every day. So I think the urgency of protecting yourself, it's much more important. I think that people have realized that before my family would say, well, it affects somebody else, it didn't affect me directly. But now we had relatives who have died, close relatives. So I think a lot of people are looking at it more of a like, I am also at risk kind of thing, and also because the health system is not able to take care of a lot of people, so younger people are dying. So here in the US, I think people have a much better chances that, well, even if I get sick, I'm 30, I'm very unlikely to die, right? We have all the technology in the world that I'm access to, all of that. There, people can't say that. So I think that's another part. And then the last part, I think when it was first talked about it, there was a lot of political implications of how, oh, you were getting um, a Chinese vaccine, or like in a way to say this vaccine is not as good as other vaccine that we could have gotten. I think that narrative has went away. Uh, so I think that was important because, and I think that our colleagues talking about how you message something, to make sure that the messaging is right from the beginning, so that this kind of false narratives is not spread, so that it sows doubt in people's mind that this product may be not as good, and I'm getting a second-rate product because I live in this country, or because I'm poor, or because of this situation. So I think that changing the narrative, I think because of the government of one of the largest state, most populous state of Brazil, rolled it out like, we think that we need it. This is what we have. We are going forward with it. I think that a lot of people start realizing that we should just do the same, because if we sit here and wait until we get something else, we may not be getting this something else, and the virus, meanwhile, is it's moving through the community like wildfire. So I think it's a combination of things, messaging, at the same time, the urgency of the pandemic all of a sudden it's huge. If we look at it, the first large wave, it affected very distinct places. Like some places really suffer a lot, like the northern region of Brazil, in Manaus, that kind of place. Now it's everywhere. Like there's a lot of people dying everywhere. So I think also the entire country are feeling the consequences of this. So a combination of various things, but that's my outside observation and just talking with family and reading the news reports.
Thank you.
Sorry, I was on mute, excuse me. So I just wanted to say thank you very much. I don't see any more hands, so maybe we could wrap this up a little bit early, just a few minutes early. I really wanted to say thank you very much to you all. So interesting. It's complex. I actually sort of went into this thinking it was going to be, there are a lot of challenges. I'm not saying it's not easy, but you've given a lot of optimism to this. And I can see that just with good community dialogue and that you're all engaged in that, maybe the hard slog, but that is definitely the way forward and the only way forward to sort of make sure we get to the pockets where there might be that tipping point in terms of convincing people to take the vaccine. But it was really insightful and much appreciated, and happy to have any follow-up conversations or connect people if there are follow-up conversations needed. So thank you very much, everyone. And for those who are staying on the line, we'll just have a little bit of a break and then come back at 9:15 for the second session. Okay, have a nice day, everyone. Thank you so much for your time. Bye-bye.
Thank you. Bye.